plan. Effective January 1, 2024, employees will be either in the select plan and choice plan. Select plan and choice plans amounts will remain the same for 2024. Some updates, we still have our free wellness clinic. We will also still offer wellness incentives, zero-cost diabetic supplies. We will maintain the 10 free mental health care visits. Some updates to the RFP from our last meeting. The clinic management was awarded to Care ATC. Right now, they are open downstairs on 1B. The Baptist Clinic on Union will still be in operation until January, until we get the new facility with Care ATC. So right now, both locations are still open and operating. Blue Cross Blue Shield of Tennessee was awarded our health care, and we will be offering the choice plan and select plan for January 24. Open enrollment is actually going on right now. MetLife will manage our leave absence. We will no longer be using the standard, and our voluntary benefits will be managed by EFP. In the past, they were managed by HRO. And if you flip over to the next page, it's just the same information about who was awarded each one of our RFPs. And so now I'm going to turn it over to Deputy Chief Person to go over our financials. Yes.
Go right ahead. See, it may work. Hit the mic close.
Care ATC that's taking over the clinics. Has there been any other discussion about getting a clinic further out east? We had kind of discussed something happening maybe.
Yeah, so right now we are still looking at locations. We have not finalized locations, but we are looking at we're looking at 2 locations on Poplar right now, and we've looked at some other areas based on the heat map that Care ATC did, but we have not finalized a place yet, but we are looking. Yes.
Thank you.
They've got some sort of new Blue Cross clinics, like the one that's across the street from Crosstown. That I don't know. It's Kevin may know more about that. The clinics that they're doing. I'm wondering, do they have those out east, and can we partner in somehow with those?
So Care ATC is different from Blue Cross Blue Shield, who's going to be managing our clinics. We are looking at, I know some Baptist locations have closed, Minor Med have closed, so we are looking at those locations to see if we can move into there.
Okay, thank you. I don't know how to tell you, Mr. Pearson, these slides are awful blurry. At least the printout. So
I
we may need to get
that.
something, maybe instead of putting 2 on one page, we may need to put 1 on a page so we can read it.
Yeah, I'm not sure why the slides have this appearance, I guess.
Yeah.
But we will make sure that it'll be better the next time.
Thank you.
Well, I thank you all. My name is Walter Person. I'm the Deputy Chief Financial Officer, 125 North Main, and I'm doing this presentation on an interim basis, but I want to also take the time to introduce you to our new comptroller, Joel Philhowers, who is seated here behind me with the white shirt on, and he will be taking over these responsibilities going forward. So I thank you for your time. Table of contents gives us the health care or the health insurance and OPEB funds comparison analysis, revenue, expense, and resources for actives and retirees. We'll look at each individual fund, Fund 721, which is the active employee fund, as well as Fund 853, the OPEB fund, and finally, the health insurance schedule for active employees from an expenditure standpoint. If you look at page 1.
Are we looking on this page?
No.
What are we looking on?
This is the document. I'm sorry. This is, and that may be
This one?
Yes.
Okay,
yes,
good, thank you.
that's-
It's not
that's
blurry.
one charmer. Okay.
I can see why you looked down and wondered what's wrong with me.
Yeah, I was, I didn't know what you had in your hand, so.
Yeah, it's okay. Go ahead.
But at any rate, thank you. So, page 1, which is entitled City of Memphis Health Insurance and OPEB Fund Comparison Analysis for the 3 months ending September 30th, 2023. We see actual year-to-date revenues for the first quarter, 17,206,901 versus last year, 15,188,306, gives us a positive variance of $2 million from an employee contribution standpoint, employee or contribution. Employee contributions are a little bit down at 3,077,000 versus last year of 4150 for a negative variance of a little over $1 million. So total contributions altogether net out to be about a $945,000 increase.
In the reason the employee contribution is down is that those are people who were in choice that didn't pay that, correct?
Yes, Chairman, that is
Okay.
correct. The migration from choice to select drove the majority of those changes, and it will likely reflect that on a go-forward basis as well, year over year, for year-to-date, year-over-year comparisons. Now, investment income, you see that we're not reflecting any investment income for actual year-to-date versus actual year-to-date September 2022, and nor do we reflect any total investment earnings for the active employee side. And that is due to a change in allocation schemes that the administration agreed upon, and primarily to attribute those interest incomes to those locations in our portfolio that really generate interest income, which would be like our concentration account in our general fund. So that is not a fundamental change in our interest-bearing methodology. Pharmacy revenues, we show $1,303,041 versus actual last year of $659,651 for a positive variance of $643. We're moving down to the expense side. We see expenses are roughly flat from a gross health claims expense side for actives, $17,827 versus $17,932. We have health expense refunds. Again, there is a higher expense refund threshold also due to the migration aspect of $24,000 versus $1,542 last year. Admin fees, we see materials and supplies. Materials and supplies is down appreciably, almost $500,000 down. Now, the material supplies number is primarily reflected, if you look on the subsequent pages, in miscellaneous professional services, and I'll get to that a little later, but that is driving the bulk of that change. Personnel, we have a health reimbursement account up appreciably at $1,040,000 versus $528,635 last year. Wellness incentives also up $47,937 versus $27,476. Death benefits roughly flat, taking us down through furnishings, PCORI tax, and net position is up $9 million at $25,374,923 versus $668,488. On the retiree side, we see employer premiums, $43.26 versus $38.71 for an increase of $455,000, and the same trend applies. Employee premiums are down $929 versus $992,000 for a $63,000 decrease. Now, on the interest and dividend side, we do see some cash-bearing returns here, so the same methodology wasn't necessarily applied to the OPEB fund. Looking forward, we see gross claims expense for, I would say, the OPEB group is down appreciably, and I believe last meeting we did discuss that. That is possibly driven also by the migration, because I think that if you look across OPEB, you see a larger majority of folks that were concentrated in the other area of choice versus select. We're looking forward, material supplies, again, that's driven by miscellaneous professional services. Other items roughly flat. Healthcare reimbursement is up 159,000 from $1 million to 840. We see death benefits up higher last year than this year. Of course, that fairly unexpected drivers behind that. Next page, page 2, you get a graphical illustration of both revenues and expenses for actives versus retirees. And looking at these numbers, they're kind of notable. If you look at our year-end June and look at the same charts, you see that you may not have those in front of you, but just to way a comparison to give you an idea of what's going on. We have seen employer premiums increasing from last year revenues of 72% of that pie chart to 79 this year. So just to point out that there have been some fluctuations as a result of the migration. I'm going to pass through similar trends reflected in the OPEB fund.
Do you have a prediction about the next year based on your current enrollment data?
In terms of
cost, I mean, the amount of premiums that are going to be paid, how many people have switched back to the choice plan that were on the select plan?
I don't have those readily available. I can't get those.
Yeah, we're going to want that next meeting. So you have it?
So
perfect. Okay, good. Thank you.
Okay, thank you.
How many did? What percentage?
Actually, very small compared to.
Did you want to come up? Chief? I'll stand to the side.
So prior to the change, we had 2,936 active employees on the choice plan and 506 retirees. With the new open enrollment numbers, we have 5,235 to stay on the select plan and 680 to go to the choice plan.
So that dropped from 1,200 to 600 by about 50%. Is that correct?
Almost.
Good, thank you. So we can make predictions sort of based on that. Okay.
Okay. I've moved on to page 4, which gives us a little bit of a deeper dive into Fund 721, or basically the active fund. And this gives us more kind of account level detail as to the transactions that are going on. We see at the top of the house revenue side, of course, we explained the interest on investments and the net income as being a change in our allocation methodology. So that's why those are zeroed out versus the prior year. We then, of course, come back to employer premiums and pharmacy revenues being up, as well as the decline in the employee contributed amount to get us to the revenue streams. Full-time salaries, we see that there was an increase in full-time salaries, which was to be expected based on some of the changes that occurred in salaries over the past year. We see holiday, rest of it pretty much is tracking in line with full-time salaries. Not a lot of material changes on the personnel side. Coming down to materials and supplies, I want to point you to the miscellaneous professional services line. If you look down there, you see $307,859 versus last year $866,554 for a variance of a negative $558,694. It's roughly $695. And again, that was driven by the timing of some of the payments, some of the major vendors that we have. The timing this year has been later than the past year, and that's driving a lot of those changes. Going down to Pecori tax, where we see another fairly significant variance, line 061201. Again, that comes from the fact that last year we ended up having to pay the Pecori tax twice. So this year actually reflects one actual quarter of taxing versus what we experienced last year. Any questions? Okay. Moving on to page 5. Interest income, the bonds, again, was subject to allocation. Now, cash equivalent interest income was not subject to that allocation. So you see there's a zeroing out effect at line 45-110, first line of the revenue stream, showing that the bonds were reallocated to other funds, whereas the cash equivalent was not. Moving down, we see, of course, the increase in pharmacy revenue, as well as a decline in the employee contributed capital. Again, if we look at personnel, we see an increase over last year, not appreciable, slightly more or less flat. And for brevity, I will again point you to the miscellaneous professional services line, where we see $273,000 this year versus $37,320 last year. Well, what happened on the OPEB side, or essentially retiree side, is we see a reversal of what essentially happened on the healthcare fund side, which is a lot of those vendor expenses actually moved into the first quarter that were paid in the second quarter on the healthcare side are now being paid in the first quarter on this side. So that is what's driving a lot of that. And the gross claim, the health claims expense of 3,835,220 versus, and that's in the total claims incurred section, versus $4,362,436. That shows a decline of $527,216. And that is driven in large part by, we see people as being a little bit more probably reluctant to incur costs on the current platform. So I think, I believe it was Tommy Malone that asked at the last meeting whether that would turn around, and I don't know that we have data to point to that just yet. We flip over to page 6. We can see Blue Cross Blue Shield choice and prescription costs, and you can kind of really visually see the migration from July through September to the select plan from the choice plan, with total claims for actives tracking pretty close, with September showing a little bit less, probably due to a lack of full data coming in for September at this early juncture. But more or less in line, 5,854 for July. Spikes up a little bit in August, close to 7 million, back down to 5.1 for October. And flipping across to our retirees, we're tracking pretty steadily along the same line with 1,154,000 July, 1.4 roughly in August, and 1.3 in September. That concludes the financial report.
So you have a summary on that?
Sorry?
You have a summary on the financial report? Where we've got surplus funds, we're down. What's the story there?
Oh, sure.
Yeah. It looks to me like we did pretty well, and
Well, we're doing
we've
well.
got money that we weren't expecting to have. Is that right?
Yeah, if you look at our total net position, I'll flip back to page 1. Our total net position for the active employees is at $26,110,734 versus $14 million in the prior year. So, yeah, we're doing well. And if you look over to retirees, we're at $10,972,000 versus $5,661,000. So we're in a strong net position going forward into the second quarter.
So when the new mayor takes over, this is going to be one of his not headaches.
Yes, sir. We're hoping this to be a bright spot.
All right.
Absolutely.
Good.
Thank you.
You're welcome. Thank you. Okay. And I guess our next is, now we've got our healthcare oversight dashboard.
Hello.
Hello.
Sorry about the printing. I couldn't read that small print either on that one. If we look at the first page of the dashboard, we've got some pretty good news here on the medical side. The number of employees and retirees is up about 2.7%, but we see total plan costs down about 9.5%. We have the used HRA contributions are up slightly, or quite a bit actually, up 70%, and that's because of all the people moving from the choice plan to the select plan that now have health reimbursement accounts. And then we see the employee premium share down about 13%, again, because of the move from the choice plan to the select plan with the lower employee contributions. So overall, we see net city per employee per month costs down 8% overall. And that includes all costs related to administering the plan and the claims. If we go to the second section of this first page, we see the cost trend for just the self-insured medical claims. And we see that they're down 15.7% for everyone. That's due to two things. One, because last year in 2022, claims were unusually high because of COVID resurgence then. And then also because of this year, again, everyone moving from the higher cost choice plan into the more cost-effective select plan with the better negotiated discounts. And I would say even if you try to normalize for those strange things going on, we still have a negative trend of about 5.6% per year if you look at it over a 2-year period, which is significantly better than what we're seeing in the market. So that's that negative 5.6% as compared to about 7% in the overall market. If we go down to the lower part of this page, we see the cost trend rates for prescription drugs. That we see up on the, particularly driven by the active employees, but it's up about 14.7% for prescription drugs. Again, driven by the active employees and by the fact that we've got, again, those drugs we keep talking about for the diabetes drugs that are being used for weight loss and some inflammatory drugs.
They're actually receiving approval now for weight loss, so we're going to see more of that.
Yep. If we open up the booklet and we look on the left side, this is the same information for just the active employees alone, and this is where you see down at the bottom of the page, we see the 18% drug trend for active employees. And on the right-hand side of the page, we see up in the upper portion of this where the retirees are maybe contributing a little bit more to the medical spend, to the decrease in medical spend, because they're down about 16.9% on the medical claims. And that, again, is because of those two factors were more extreme for retirees. One, they had bigger incidence of COVID in 2022. And then secondly, there was a larger proportion of the retirees that were moved from the choice plan to the select plan. So it's a little more extreme of a trend change there. On the back of the booklet, we're looking at utilization, services per 1,000. They're down across the board except for emergency room. We think things are just kind of normalizing back a little bit to where they should be with COVID calming down over the last year. The one exception, like I said, is emergency room, which is at about a 9.5% trend. And frankly, that's something that the city has always struggled with a little bit with the trend on the emergency room. So we'll have to try to look for some options to try to correct for that a little bit. On the cost per service, we see across the board for everything facility related that the trend is down and down pretty significantly. And again, that's because of the better negotiated discounts in the select plan. So it'll be interesting to see if we see those tick back up a little bit now that the choice plan is an option again. But to the point that Chief Fouché mentioned, it was really pretty good news. While some people did go back into the choice plan, pretty small percentage. So hopefully it won't have a lot of impact and it'll continue to have some good impact for the city. If we look down into the prescription drug section, we see total fills per thousand are down a little bit at about -2%. However, we see the big increase in the cost per day supply at 17% trend up. Again, due to those primarily to those weight loss drugs. And then down on the bottom of this back page, we see about 64% of folks in the medical plan are participating in the wellness program and the wellness incentives, with the most participation in the dental incentive, which was put into place, I believe, this past year. And we see redemptions at about 41% of those folks that have earned incentives in the wellness program. And that's it. Any questions? Okay.
Looks good.
Okay.
Thank you. I can read it.
I'm surprised. See, that's almost 2,000 participating wellness programs. That's great.
I know, it's really good.
Good afternoon. Andre Cleveland, Total Rewards Officer, 2714 Union Extended. As you know, we are in our open enrollment season. We've just completed open enrollment for our active full-time and part-time employees. That took place October the 9th through November the 3rd. Starting next week, we'll begin our open enrollment for our retirees. That will start on Monday, November the 13th through November the 30th. Looking at, if you go to the next slide, if you look at our current open enrollment numbers, among active employees, we have approximately 5,900 people who have enrolled so far. Of that number, 2,100 are of fire service, police services, and 1,500 are of fire services. So we have approximately 86% enrollment rate thus far. And looking at the plans that were selected, if you look at the select plan, we had a total of 5,200 people who have signed up for the select plan so far. Of the choice plan, 680. Just taking a recap back to first quarter, you'll notice that we had approximately 2,900 people that were on the choice plan, active employees. The retirees were 506. So considering who chose to go back to the choice plan, you're looking at about 23% of the population decided to go back to the choice plan, while 77% decided to remain on the select plan.
So that was 23% of the people who were on it before, or 23% of the total?
23% total.
Total, okay. So out of the people who were on it, you said, what was the percent that was on it before? Was it 40%, 45%? The percent on choice prior to the abrupt change.
So for the choice, we had approximately 2,900. I didn't report the percentage. Is it 47?
So we went from 47% to 23%. So,
Right.
Okay. So at least a 50% reduction. That's good.
Okay.
Right, thanks.
Looking at our quarter-over-quarter benefit participation, you can see that we're kind of trending evenly, no major changes. So far, we're looking relatively good on that. We've got approximately 5,800 total for the year up until this point. And for retirees have trended up some. We've got a total of 962 for the select plan. And like I said, we are seeing it kind of trend up relative to the select plan for retirees. Looking at prescription drugs, we see that Ozempic seems to be the highest medication that's given out for diabetes.
When you guys are doing this, is there a particular reason that you're acting like a different dose of Ozempic is a different medication? Because you've got Ozempic on here 3 times.
Okay.
It's on it 4, 2, and 8 milligrams.
What's going to do with the cost?
Yeah, I know, but I think that if we're looking at a drug, we should put that drug no matter what its cost is.
Regardless of the-
And then we're probably going to have 3 other high-cost drugs that come on this list if we look
Okay.
at it that way.
Okay.
Because this makes it look like it's not by far the leading cost driver.
Okay. We'll note that and
I understand.
I'll make the
Makes
adjustment
sense.
going forward.
Okay, thank you.
And then the last prescription drug update from July 1 to September 30th. You can see it's the same medication relative to diabetes and inflammation. The claims paid out was $2 million, and I'm sorry, but on the previous slide, the claims paid out was $4.6 million for those. Okay. Any questions? Thank you.
Thank you. Yeah, I would definitely do that with the Ozempic because that's one drug. It's just, and I think if you look at that, it is by far our most expensive drug, bar none, because it essentially is 3 times more than we're paying for any other medication.
Okay.
All right, thanks.
Thank you.
Wellness update. Okay.
Yes. Good evening, everyone. Melanie Scott, Employee Engagement and Compliance Manager, 2714 Union Avenue Extended. So we'll look at our top 10 diagnoses that we're seeing in the Employee Health Center, the clinic. We haven't seen much variance from Q2. Our top 10 are primarily the same, with the exception of COVID-19 and middle ear infection are newly added in our top 10 list. Clinic utilization on the next slide. Current quarter, we've seen 1,304 patients. For the year to date totals, we've seen 3,731, and that's an 11% increase since last quarter. Next slide. Our diabetes management program is doing well. Currently, we have 259 employees enrolled, with 236 of those activated and actively using the platform. 79% of our users are using the blood glucose meter, and their checks are within normal limits. We're seeing a negative 1.73% change in the HbA1c for those starting as uncontrolled. And in terms of program engagement, we're seeing high engagement in glucose meter usage, self-guided activity, and digital coaching. For our pre-diabetes management program, we have 527 users, with 83% enrolled and actively using the platform. We've seen 68% of our activated users see weight loss since their initial weigh-in. I couldn't read my handwriting. We're also seeing a high engagement in device usage, so that just means that our employees are using the digital scale that comes with the program, and they are utilizing the app, the support resources, and the food log. Our hypertension management program, we have 647 employees enrolled, with 81% that are actively using the program. 85% of those members have maintained or improved their blood pressure control. In terms of engagement, we have high engagement in device monitoring. So that means that they are utilizing the blood pressure monitor that comes with it, and they are utilizing the apps and the resources as well as the food log. Next slide. As mentioned earlier, we do have a new clinic manager, Care ATC, and under their management, employees will see increase in services to include primary and preventive care, chronic disease management, on-site labs and medications at no cost, and they can also utilize the mobile app to schedule appointments and view their medical records. We are looking to open a second site soon that will also further expand our services to include mental and behavioral health, nutrition services, physical therapy, diabetes management, and occupational health and pre-employment testing. And we invite you guys to come out on Monday to our grand opening of the City Hall Clinic. That's Monday from 11 to 1. We are currently seeing patients, but we'll do an official grand opening on that day. Any questions?
Ms. Scott, is this second employee health center site, is that going to be in addition to the one on Union?
No. So the one on Union is currently managed by Baptist.
Right.
The new provider will have a second location, and we'll close down the Union
Okay,
location.
all right.
Do your diabetic management patients have continuous glucose monitoring, or are they using AccuCheck machines and sticking themselves? Do they have Libra patches that they use with their devices?
That I think, let me find out. I'm not exactly sure. I know the program comes with the glucose monitor, but you have some diabetes patients that may already have the little thing that they use.
I'm just saying that may be one way if you're having trouble recruiting people to do the program. If we can look and see if we can get those Libra monitors, we found that it really does improve compliance in monitoring your glucose and will help get that A1C down further. And on your blood pressure management program, are you providing the blood pressure measurement device to everyone who enrolls?
Yes.
Okay. And for that, I see that you've got 3,500 people recruitable. Are you getting that based on their pharmacy claims? And if they're on a high blood pressure med, that's how you're saying who's recruitable?
Recruitable is based on claims.
And it's claims from pharmacy or claims from doctors' offices and their diagnoses? You don't have to tell me today, but just let me know. I want to know how you're getting your data to recruit people, see if we can make sure we don't miss anyone who could be there.
Yes, sir.
Okay. Any other questions?
Yeah.
All right. All right, thank you. And it looks like... Is that the end of, is that all you got for today? Well, listen, thank you much. That was great information. I'm sorry I was late.